This is Lewis, and he is unable to access affordable health insurance in South Carolina.
You are basically, I won't say it, but up a creek without a paddle if you are in a dire need, as far as like I am, as far as with medical condition.
Like many of us, Lewis works for a living and has been very healthy, but now that is not the case.
And what he told me is that I have, in my left eye, a partially detached retina, and my diabetic retinopathy has gotten so severe in both eyes that the Avastis or Lucentis injections would no longer work. I would have to have laser surgery on both eyes. So they do the MRI. About 45 minutes later, she walks in the room and gives me the scariest news in the world. She told me that I had suffered 3 to 5 mini strokes over the past 7 to 10 days. She goes, now, if you had to have a stroke, this is the best type, but there's nothing we can really do about it. Okay. So I come home, and the stress of finding out that I had strokes and that I'm due to have more caused my blood pressure to go through the roof. And anything that goes wacko in your body makes your sugar levels go crazy. And that caused my diabetic retinopathy to come back with a vengeance. So, not having insurance, the gap being there, I'm now something that I've never wanted to be, which is a burden on society, in a sense. I had to rely on people. And I've always prided myself, even as a young kid, not to rely on people.
The insurance coverage gap exists because South Carolina has not expanded affordable health care access to those up to 138% of poverty, leaving 194,000 individuals in the gap where they do not qualify for Medicaid and make too little to get tax credits to help buy coverage through the new marketplace.
Have not worked since November, but I was supposed to start working in March, and I have not been able to. And in fact, I've had customers that have called me back and forth asking me, hey, springtime's coming up. We talked about this project, that project, and I cannot do it because I can't see well enough.
Lewis has started a GoFundMe page to raise money for his medical expenses. Lewis says he has tried reaching out to South Carolina's elected officials.
Nobody will return my call. And understand, the reason why I went public with all this, which I've been criticized, was one, to call awareness to the gap because I didn't know about it. The first thing that needs to be done, politics needs to be taken out of it. Because as soon as you incorporate politics into healthcare, you're disavowing half of the country. Whether it's a Republican, whether it's a Democrat, whether it's the rich, or whether it's the poor, it does not matter. Politics has no right being in healthcare.
If South Carolina accepts the federal funding to cover individuals up to 138% of poverty, that would solve Lewis's problem.
I am, as people have been calling me, the human element of this gap. And like me, I think, Lauren, you told me there's 149,000. 194,000. Just in the state of South Carolina that are in my condition, not all of them as far as with health issues, but that would fall in the gap. And I would tell, as far as that politician, those 194,000 people are your constituents. And you're supposed to do what's good for everybody, not for just a few.
If you were not in the gap anymore and had access to health insurance, how would that change your life right now, and your family's life?
Well, I'd be able to get the treatment that I need, and the end result would be is I'd be able to go back to work and be a productive member of society.
Lewis is not alone. In South Carolina, there are thousands of people who fall into what is known as the health insurance coverage gap. Many have serious health issues and are unable to access affordable health care. South Carolina lawmakers can fix this problem with their vote, and thousands in the Palmetto State can have access to health care they need. You can help South Carolina Appleseed Legal Justice Center close the gap. Visit closethegapsc.org and scjustice.org.